So we'll continue with the class. The next topic I'll be dealing with it is gastroesophageal reflux disorder. Gastroesophageal reflux disorder. So gastroesophageal reflux disorder, it is a digestive system disorder that affects the lower esophageal sphincter. Okay, that usually affects the lower esophageal sphincter. So gastroesophageal reflux. Okay, gastroesophageal reflux is a digestive disorder that usually affects the lower esophageal sphincter, that is the muscle, the rise of the ring of the muscles between the stomach and esophagus. So gastroesophageal reflux disorder, it is usually a digestive disorder which mainly affects the lower esophageal sphincter. Okay, which usually affects the lower esophageal sphincter, the ring of muscle between the stomach and esophagus. So generally reflex, it means flow back or return. Okay, generally reflex means flow back or return. So therefore gastroesophageal reflex is the return of the stomach contents. Okay, gastroesophageal reflex is the return of the stomach content to the into the esophagus. Okay, return of the gastric contents into the esophagus. So gastroesophageal reflux disorder is usually a disorder that usually affects the digestive disorder that usually affects the lower esophageal sphincter, that is the ring of the muscles between the stomach and esophagus. Okay, the ring of the muscles of the stomach and esophagus. So therefore generally reflex, it is mainly flow back or return. So here in this gastroesophageal reflex, the stomach contents usually return back or move back to the contents, move back up to the esophagus. Okay, to the esophagus. So this condition is usually associated with weak or relaxed lower esophageal sphincter. Okay, it mainly occurs due to weak esophageal sphincter. Okay, it mainly occurs due to weak esophageal sphincter. So gastroesophageal reflux usually is a digestive disorder that mainly affects the lower esophageal sphincter, that is the ring of muscles between the stomach and the esophagus. So reflex generally it means move back or return. So gastroesophageal reflex, it is nothing but return of the stomach contents into the esophagus, and this usually occurs due to weak esophageal sphincter, weak lower esophageal sphincter. So that is usually there in infants below the age of 1 year. Okay, infants below the age of 1 year, it occurs due to inadequate development of the lower esophageal pressure regulation. Okay, so then infants below 1 year. Okay, infants below 1 year. So this usually occurs due to inadequate development of the lower esophageal pressure regulation. Okay, to the inadequate development of the lower esophageal pressure regulation. So so that is usually about this thing. So that is in infants it usually occurs due to inadequate development of the lower esophageal pressure regulation. So that is about this thing. So that is mainly there will be return of the stomach contents up to the esophagus. So next is causes. So causes can be like it might be due to any cerebral defects. Okay, it can be due to any cerebral defects, or it might be due to delayed neuromuscular development. Okay, it might be due to delayed neuromuscular development, or in case of hiatal hernia. Okay, in case of hiatal hernia. Okay, it usually occurs due to in case of hiatal hernia, or in case of obesity. Okay, or in case of obesity or during pregnancy. So that is the causes can be, it might be due to cerebral defects or due to delayed neuromuscular development, due to hiatal hernia, or in case of pregnancy. So that is usually about the causes of this gastroesophageal reflux. So next is symptoms. So symptoms, there will be unexplained vomiting. Okay, so there will be unexplained vomiting. So the vomiting, there will be continuously vomiting which cannot be explained. So that is unexplained vomiting. Next, it will be like immediately after each feed the baby might vomit. Okay, immediately after each feed the baby might vomit, and then there will be regurgitation. Okay, there will be regurgitation. Then the baby might refuse to feed. Okay, the baby might refuse to feed. Dehydration will be there. Irritability. Okay, the baby might become irritating, and then continuously the baby might be crying. Okay, continuously the child might be crying. Ache, pain will be there. Stiffening will be seen. Next, sleep disturbance will be there. So that sleep disturbance will also be there. Loss of weight will be there. Failure to gain, loss of weight will be there. And then this might lead to respiratory symptoms also. Okay, this might lead to respiratory symptoms also, like cough, chest discomfort. So cough, chest discomfort, and if they aspirate, it might lead to pneumonia also. Okay, if they aspirate, they might lead to pneumonia also. So that is usually the symptoms that is usually seen in case of gastroesophageal reflex. So normally it is usually seen, it is that unexplained vomiting will be there. Immediately they vomit when they feed, due to which they will refuse to eat, and then they will be having pain, stiffness will be there. Weight will not be increased because they are not able to have food. They become dehydrated, they become irritable, sleep disturbance will be there, they will be continuously crying, regurgitation can occur, and also so that is usually what happen, and it might lead to respiratory symptoms also, like cough and chest discomfort. If this aspirate, that might lead to pneumonia. Okay, if they aspirate, that might lead to pneumonia. Okay, so that is usually about this symptoms that is usually seen in case of gastroesophageal reflex. So next is diagnosis. Diagnosis, we go with history collection. History collection should be done, and then also we have to collect, like when we are collecting the history, we have to check the like vomiting. So like vomiting, like from when it started, how long, like that is usually what happens. So when it starts, like vomiting, history of vomiting should be checked, and also their feeding pattern has to be assessed. Okay, their feeding pattern has to be assessed, like what are the food that they are eating, like their style, like what are the food they are having. Okay, like what are the food they are having, whether they are having irritating foods, gastric irritating foods, or they are having normal diet. So everything should be collected. Okay, everything should be collected. Then we have to check for the time and the type of vomiting. Okay, the time as well as the type of vomiting that is they do after feeding. Okay, that they do after feeding. Then we have to go with endoscopy. Esophageal histology should be done. Okay, esophageal histology should be done, and barium swallow X-ray should be done. Okay, barium swallow X-ray should be done. So that is usually about the diagnostic evaluation that we go. So that is mainly history of vomiting, and also the feeding pattern has to be assessed. Then we have to check the time and the type of vomiting they do after feeding. Esophageal histology should be assessed, and barium swallow X-ray has to be done. So that is usually the diagnostic evaluation that we do. So next is management. So management, it mainly includes medical management, so, and also surgical management will also be done. So it is mainly medical management is usually done, as well as surgical management is done. So management mainly depends upon the cause of gastroesophageal reflex. So the management mainly depends upon the cause of gastroesophageal reflex. So it is usually depending upon the cause, the management they go with giving treatment. Okay, depending upon the cause, they go with giving treatment. So that is usually about this thing. So medical management is usually if there is no improvement in the medical management. Okay, when they go with medical management, and if there is no improvement in the medical management, then they can go with surgical management to maintain the growth and development of the child. Okay, to maintain the growth and development of the child. So that is usually about this thing. So medical management, we'll see what are the medical. So mainly management mainly depends, like medical management and surgical management. Medical management mainly like this management mainly depends upon the cause of the gastroesophageal reflex. So that is mainly they have to go with the cause, and if medical management, if they are not able to improve, the condition is not improving through medical management, then we can go with surgical management to maintain the growth and development of the children. So next is medical management. So medical management, the first thing that we go, it is positioning. So normally positioning, so this is necessary because it might reduce the gastric reflex. Okay, positioning is required because it will reduce the gastric reflex. Okay, positioning is required because it might reduce the gastric reflex. And then in case of infants, okay, in case of infants, if they are younger than 6 months, okay, if they are younger than 6 months, then the infant should be placed in an upright position. Okay, the infant should be placed in an upright position with the head slightly raised. Okay, with the head slightly raised or turned to one side. Okay, head slightly raised or turned to one side, supporting with the pillows. Okay, supporting with the pillows. So that is usually done. Then burping should be required. Burping should be done after each feed. Okay, burping should be done after each feed. And during sleep, the infant should be placed in a sideline position. Okay, the infant should be placed in a sideline position with head slightly raised. Okay, with head slightly raised. So that is in case of older children, semi-paulus position can be given. Okay, in older children, semi-paulus position can be given, and at least this position should be given after meal for at least 3 hours. Okay, this position should be given after meal for at least 3 hours. Okay, it should be given. This position should be maintained for at least 3 hours after the meal. So this is about this positioning. Positioning, it is required as it might reduce the gastric reflex. So in case of infants who are less than 6 months, then they can be placed in an upright position with the head slightly turned towards one side, supported with the pillow. Burping should be done after each feed. And during sleep, the infant should be placed in left lateral side lying position with head slightly raised. And in case of children, they can be given semi-forward position, and this position should be maintained for 3 hours after the meal. So that is usually about this positioning. So next is feeding. So in case of feeding, special attention should be given. Okay, feeding, special attention should be given for the feeding for infants as well as for the older children also. For the infants as well as for the children also. So in case of infants, breastfeeding should be done continuously, and also from after each feed of breastfeeding, infant should be burped. Okay, infant should be burped. So breastfeeding should be done. Like after each feed, burping has to be done. Okay, after each feed, burping has to be done. So that is usually done. Next is that infant, if their supplementary feeding is started, okay, if an infant supplementary feeding is started, it should be given this thickened feed should be given in small amount. Okay, thick feed should be given in a small amount, and also we have to avoid the baby to be in supine position at least 3 hours of. We have to not put them in supine position at least for 3 hours. Okay, they should not be kept in supine position at least for 3 hours. Okay, at least for 3 hours. So that is usually about this baby infants. That is infant if they started with supplementary feeding, or if the infant is started with supplementary feeding, then we have to give with thick feed in small amount. Okay, thick feed should be given in a small amount, and they should avoid them to keep in supine position at least 3 hours after the feed. So then that is then held them upright position. Okay, held them upright position to avoid regurgitation. Okay, held them in upright position to avoid regurgitation. So that is usually done. Then in case of older children, okay, in case of older children, give less fluid food. Okay, give less fluid food, and then usually less fluid with food. Okay, give less fluid with food. Okay, so that is in older children we have to give less fluid with food. Provide liquid in small amount. Okay, provide liquid in small amount, and it should be given at frequent intervals. Okay, it should be given at frequent intervals. That is, we have to give less fluid diet food for the older children. Then we have to avoid all gastric irritant foods. Okay, we have to avoid all the gastric irritant foods such as spicy food, foods such as onion, citrus, tomato, carbonated beverages. So all these things should be avoided. Okay, we have to avoid all the gastric contained food. Okay, we have to avoid all the gastric contained food. So that is to be avoided. Next is chewing gum can be given to the children because it might stimulate the peroxide secretions. Okay, it might stimulate the peroxide secretions, which helps to clear esophagus. Okay, chewing gum can be given as it might stimulate the peroxide glands to clear the esophagus. Okay, it stimulates the peroxide gland and clear the esophagus. So this is usually about this feeding. So normally feeding in case of infants, breastfeeding should be given and burping should be done. And if supplementary feeding is started, then we have to give them thickened feed, and also supine position should be avoided at least for 3 hours. Then they can give in upright position to avoid regurgitation. In older children, less fluid food, that is in between the food, they should not give this fluids, and then the fluids can be given in regular intervals. And then chewing gum can be allowed so that they can, parotid glands will be stimulated and it might clear the esophagus. So this is about this medical management, that is positioning as well as feeding. Then we can go with giving medications, that is antacids can be given like cimetidine, like antacid H2 receptors can be given. Okay, antacids such as H2 receptors can be given like cimetidine, omeprazole or metoclopramide. Okay, so that is usually medications can also be given like antacid H2 receptors can be given like cimetidine, omeprazole and metoclopramide can be given. Okay, so this is about this medications. So next is surgical management. Surgical management, it is mainly done to prevent complications. Okay, in order to prevent complications, so that is usually recommended. So normally Nissen operation is done. Okay, normally Nissen operation is done. So in which fundus is wrapped around the lower esophageal sphincter. Okay, so normally Nissen operation is done in which the fundus it is wrapped around the esophageal sphincter. Okay, fundus is wrapped around the esophageal sphincter, that is at a 360-degree wrap. Okay, that is usually complete wrap. Okay, so where fundus will be wrapped around the esophageal sphincter, because the esophageal sphincter is only affected, right? Esophageal sphincter is only affected, so therefore they'll go with a complete wrap around the esophageal sphincter. So this usually will prevent this reflex. Okay, this usually prevents this reflex. So this operation is mainly done through gastrotomy. So that is usually done. So this is about the surgical management. Surgical management mainly we go with to avoid this complication. So where we go with Nissen operation, in which the lower esophageal sphincter will be wrapped with the help of a fundus. A 360 wrap will be done, and because this is usually affected, and this operation is mainly done along with gastrotomy. Okay, this is about the surgical management and medical management. Medical management, we go with giving them proper position, proper feeding, medication. Surgical management, we go with Nissen operation. So this is about this gastroesophageal reflex. It's nothing but return of stomach content to the esophagus due to weak lower esophageal sphincter.